Hello, I am Dr. Audrey Arona, District Health Director for Gwinnett, Newton, and Rockdale County Health Departments. We are experiencing a massive surge in COVID cases, higher than ever since this pandemic began. In this video, I want to update our community as to where we are in our fight against COVID and to provide the latest information to keep everyone up to date. Not even 3 weeks ago, Georgia was experiencing about 1,500 new COVID cases per day, but currently we are seeing close to 20 to 25,000 new cases every day. We believe this is due to the Omicron variant, which is much more contagious than any other variant of COVID so far. Omicron seems to cause less severe disease and less hospitalizations and deaths than we have seen with Delta and previous variants. However, because of the sheer volume of cases, our hospitals are overwhelmed and severely understaffed. Hospitalizations across the country have doubled since Christmas. Most of the hospitalizations and deaths we are seeing from COVID are still within the unvaccinated population. And we are also seeing a rise in flu cases, causing hospitalizations and deaths, again, primarily in those not vaccinated against influenza. With the rise of the Omicron cases, the cold weather, the holidays and travel, the demand for COVID testing hugely increased, causing long lines and hours of wait times to get a test for COVID. And 1 out of 3 people being tested were positive for COVID. Since the holidays are now over, the ability to get a test is easier. But we are still seeing a lot of sick people, and we need to all be very careful to protect ourselves and our families from becoming infected. In Gwinnett County, only about 56% of our overall population is fully vaccinated. In Rockdale County, 51% of the overall population is fully vaccinated, and in Newton County, only 44% are fully vaccinated. COVID vaccines are easy to find. At our locations, no appointments are necessary. There are no lines to receive a vaccine, and the vaccines are free to those insured, uninsured, and undocumented. What we have learned from COVID or Omicron is, if you have received your vaccine doses previously and are due for the booster, that booster dose is really important to protect yourself from infection. Booster doses for Pfizer are approved for individuals 12 years old and older and are now recommended at 5 months after vaccination for Pfizer and Moderna. The vaccine is the best tool in our tool belt to fight COVID. If you are hesitant to get the vaccine, please reach out and talk with your doctor or a trusted medical professional about your questions and your concerns. Every single vaccine given will save someone's life. The rise in COVID cases is causing staffing shortages everywhere, and we have seen store shelves going bare again as the supply chains struggle to keep up. I know that we are all tired of COVID, but we must remain diligent and do our part, following safety measures and getting vaccinated. This pandemic would be over if everyone stepped up to get vaccinated. Here are some things that you can do to help. First of all, remember to wash your hands and use hand sanitizer often. Secondly, wear your masks. They work to protect you from others, but they also work to protect others from you. And remember that a person is contagious for 2 days before any symptoms start or before anyone tests positive. Also, look for symptoms like fever, cough, congestion, fatigue, body aches, headache, nausea, vomiting, stomach pain, or just a sense of not feeling well. Stay at home away from others and find a test. Next, follow isolation and quarantine guidelines. I know that they change, but we are still learning about this virus. So just keep up with the latest changes and follow them. We have provided a link in the description below with a flow chart for you to use to be sure that you're following the correct guidance. We are also providing a link to help you find a location for a COVID test. And then there's another link also to help you decide if you need a PCR test, a rapid test, or a home test. If you haven't gotten your COVID vaccine, please do. The vaccines have been on the market for over a year now. They have been proven to be safe and effective, and our community needs you to do this. We have a link attached to this video that shows who is eligible right now for the COVID vaccine. And lastly, if you haven't gotten your flu shot, it's not too late. Please get it today. You can get the flu vaccine and the COVID vaccine at the same time. We're seeing cases of what's called flurona now, where people are testing positive for both COVID and flu at the same time. This is the year to be sure you're protected. So those are the latest highlights and must-knows for now. As always, visit the following websites often for trusted information that is current and accurate about COVID-19. And please be safe.